Hello friends, welcome all of you on my YouTube channel here Anand Nursing File. Today in this video we'll learn about the nursing care plan on pulmonary embolism. This is very important care plan, and in this video we learn this care plan through the nursing processes step like nursing assessment, diagnosis, goal, intervention, rational and evaluation. And this is very important care plan, and this video helps you for writing care plan in university examination purpose और for the assignment work purpose. तो फ्रेंड्स आप वीडियो को ध्यान से देखिएगा, लर्न कीजिएगा। तो आइए देखते हैं केयर प्लान ऑन पल्मोनरी एम्बोलिज्म। तो यहाँ देखते हैं नर्सिंग केयर प्लान ऑन पल्मोनरी एम्बोलिज्म। इससे पहले हम यहाँ पर पल्मोनरी एम्बोलिज्म का एक शॉर्ट इंट्रोडक्शन देखते हैं। व्हाट इज पल्मोनरी एम्बोलिज्म? A pulmonary embolism is a blood clot in the lung that occurs when a clot in another part of the body, often the leg or arm, moves through the bloodstream and becomes lodged in the blood vessels of the lungs. Pulmonary embolism is जो blood clot है वो लंग्स में प्रेजेंट होता है, और इसका कारण मीन्स जो क्लॉट है मीन्स जो दूसरे बॉडी पार्ट्स से मूव होकर ब्लड वेसल्स में पहुंचता है। The restrict blood flow to the lungs, lower oxygen level in the lungs, and increase blood pressure in the pulmonary arteries. If a clot develop in a vein, it is vein and it stay it there is called thrombus. जो clot है उसको thrombus के नाम से जानते हैं. If the clot detach from the wall of the vein and travel to another part of your body, it is called embolus. Means जब ये थ्रोम्बस वेन से डिटैच होकर ब्लड के सर्कुलेशन से के साथ मूव करता है, दिस इज द मूविंग क्लॉट, दिस इज कॉल्ड एम्बुलस। नेक्स्ट डिफाइनिंग करेक्टरिस्टिक्स देखते हैं अपन, इसके बेसिस पर हम नर्सिंग केयर प्लान को यहाँ राइट करेंगे। सिम्टम में इंक्लूड सडन शॉर्टनेस ऑफ ब्रेथ वेदर यू हैव बीन एक्टिव और एट रेस्ट, unexplained sharp pain in your chest, arm, shoulder, neck or jaw. The pain may also be similar to symptom of a heart attack, cough with or without body sputum. Next, pale, clammy, bluish color skin, rapid heartbeat, pulse, excessive sweating. In some cases, feeling anxious, lightheaded, faint, or passing out. Wheezing, fever, coughs, syncopes. These are the defining characteristics, and also your mental stress, alteration, hypotension. On the basis of these symptoms or defining characteristics, we write here the nursing care plans, nursing diagnosis. देखते हैं हमारा जो मेन टॉपिक है केयर प्लान का किस तरह से हमने यहाँ राइट किया है। दिस इज फर्स्ट केयर प्लान एयर डायग्नोसिस इम्पेयर्ड गैस एक्सचेंज। तो इसमें देखते हैं हम जो नर्सिंग प्रोसेस है, स्टेप है, नर्सिंग असेसमेंट, डायग्नोसिस, गोल, इंटरवेंशन, रेशनल जो हमने यूज किए हैं, एंड एवेल्यूशन वो लास्ट में हमने लिख रखा है केयर प्लान के। तो आपको ये सारे यहाँ पर लिखना है। इम्प्लीमेंटेशन हमने नहीं लिखा है, मीन्स दिस इज एक्टिंग फेज जो आप बाढ़ में लिखते हो केयर प्लान, उसके लिए वो कंपलसरी है, आपको इम्प्लीमेंटेशन लिखना है। जैसे कि नर्सिंग इंटरवेंशन का आपको इम्प्लीमेंटेशन लिखना है, असेस का असेस द स्किन कलर। तो इस तरह आप इम्प्लीमेंटेशन में इसका यहाँ पर लिख सकते हो। तो सबसे पहले देखते हैं सब्जेक्टिव डाटा। Patient complaint about breathing difficulty and headache, and objective data assess vital sign, ABG study, assess paleness of the skin, hypoxia. Next diagnosis देखते हैं यहाँ पर। Impaired gas exchange may be related to decreased lung perfusion caused by the obstruction of pulmonary arteries, blood flow by the embolus. गोल होगा टू मेंटेन एडिक्वेट गैस एक्सचेंज, नर्सिंग इंटरवेंशन रेशनल देखते हैं। फर्स्ट इंटरवेंशन, here assess the skin color, nail bed and mucous membrane for color change, रेशनल होगा when oxygen and perfusion become impaired, peripheral tissue become cyanotic। तो इस तरह से हमको इंटरवेंशन रेशनल लिखना है। यदि आपको यहाँ पे इम्प्लीमेंटेशन लिखना है तो यहाँ पर होगा इम्प्लीमेंटेशन असेस्ड द स्किन color, nail pad and mucous membrane for color changes। Second intervention, monitor for any changes in vital sign, रेशनल होगा in initially hypoxia and hypercapnia there is an increase in the respiratory rate, heart rate and blood pressure। Next, third, assess for the sign and symptom of hypoxia such as confusion, headache, diaphoresis, restlessness, tachycardia and pale skin। रेशनल होगा hypoxia results from increased dead space ventilation without perfusion that reduces effective gas exchange। Number fourth intervention, auscultate lung sound, noting area of the decreased ventilation and decrease and the presence of adventitious sound air। रेशनल होगा critical are common clinical findings with pulmonary embolism। Number fifth, assess for the sign and symptom of pulmonary infarction such as fever, cough, bronchial breathing, hepatitis, pleuritic pain, pleural friction drop and consolidation। ये रेशनल होगा a large pulmonary embolus or multiple small clot in a specific area of the lung can cause ischemic necrosis or infarction of the lung area। नंबर सिक्स इंटरवेंशन देखते हैं, assess for calf tenderness, redness, swelling and hardened area। ये रेशनल होगा pulmonary embolism often arises from a deep vein thrombosis। नंबर सेवन इंटरवेंशन, monitor for any changes in the ABGs। ये रेशनल होगा later sign of respiratory failure include low PO2 and elevated PaCO2। Next, monitor oxygen saturation as integrated air oxygen saturation should be at 90% or greater। Number 9, maintain client on bed rest, may resume activity gradually as tolerated air रेशनल होगा this will decrease the oxygen demand during an episode of acute respiratory distress। Number 10, position the client properly to facilitate ventilation perfusion matching। air रेशनल होगा upright and sitting position optimize diaphragmatic excretion and lung perfusion। Number 11, administer oxygen as indicated रेशनल होगा supplemental oxygen maintains adequate oxygenation। Number 12, intervention, anticipate the need to start anticoagulant therapy and if there is massive thromboembolism the use of thrombolytic therapy। रेशनल होगा heparin is used to prevent the recurrence of emboli if a massive thrombus is present or if the client is hemodynamically unstable, thrombolytic therapy। Example, alteplase is used to directly analyze or dissolve the clot। Sorry. After providing these interventions, we write here the evaluation of this care plan. Here evaluation is adequate gas exchange. Sorry, maintained। ये था फर्स्ट केयर प्लान। नेक्स्ट देखते हैं सेकंड केयर प्लान। यार नर्सिंग असेसमेंट, डायग्नोसिस, गोल, इंटरवेंशन, रेशनल। सेम स्टेप, फर्स्ट सब्जेक्टिव डाटा यार पेशेंट कंप्लेंट अबाउट ब्रीथिंग डिफिकल्टी एंड हेडेक and objective data here abnormal arterial blood gases, desaturation, oxygen saturation below 90%, dyspnea, hypoxemia, impaired chest excretion, restlessness, tachypnea, tachycardia, use of accessory muscles। On the basis of these assessment data we write here the diagnosis। Diagnosis here ineffective breathing pattern related to pulmonary embolism। गोल होगा to maintain effective breathing pattern। nursing intervention रेशनल लिखते हैं फर्स्ट assess the client's anxiety level here। anxiety can result in rapid shallow respiration and increased dyspnea। Number second, assess the respiratory rate, rhythm, and depth. Assess for any increase in the work of breathing, shortness of breath, and the use of accessory muscles. Respiratory rate and rhythm changes are early sign of impending respiratory distress. Tachypnea is a typically finding of the pulmonary embolism. Number third, assess the characteristics of pain, especially in the association with the respiratory cycle. Pain is usually sharp or stabbing and get worse with deep breathing and coughing. It can result in shallow respiration, further impairing effective gas exchange. Next, monitor arterial blood gases, aeration ABG shows PO2, PaCO2. Number 5, monitor oxygen saturation as indicated oxygen saturation should be 90% or greater on room. Here next, provide reassurance and allay anxiety by staying with the client during acute episode of respiratory distress. Here, the presence of a trusted person may be helpful during periodic periods of anxiety. Next, severe intervention, position the client in a sitting position and change the position every 2 hourly. If not contraindicated in a sitting position, allow good lung exclusion and chest expansion. Next, number 8, encourage deep breathing and cupping exercise. Suction as indicated in cupping is the most productive way to remove secretions. The client may suctioning is indicated with clients are unable to remove secretions. Number 9, interventions. Prepare the client for diagnostic studies such as chest X-ray, diameter, pulmonary arteriogram, etc. Aeration common tests such as a chest X-ray examination and D-dimer assay. A marker for clot lysis are readily available in acute care settings, especially to rule out pulmonary embolism. Next, administer oxygen as indicated aeration supplemental oxygens, maintain adequate oxygenation. Next, 11, intervention, anticipate the need for intubation and mechanical ventilator. Mechanical ventilation intubation and positive pressure ventilation are a mean to stabilize breathing and ventilation and prevent decompensation of the client. After providing these interventions, we write here the evaluation for second care plan here, maintain effective breathing pattern. Next देखते हैं केयर प्लान थर्ड ईयर रिस्क फॉर ब्लीडिंग नर्सिंग असेसमेंट में देखते हैं सब्जेक्टिव डाटा नॉट एप्लीकेबल बिकॉज दिस इज द रिस्क डायग्नोसिस एंड objective data here assess the prothrombin time partial partial thromboplastin time and international normalized ratio INR within the normal range. Here nursing diagnosis होगा risk for bleeding may be related to anticoagulant or thrombolytic therapy goal to reduce risk for bleeding. Nursing intervention rational देखते हैं first intervention assess for the history of a high risk bleeding condition liver disease kidney disease severe hypertension bacterial endocarditis and heparin induced thrombocytopenia. Rational होगा because anticoagulation therapy is the hallmark treatment for pulmonary embolism prior the client experiences with the bleeding or anticoagulants must be assessed before treatment. Second, assess for sign and symptom of bleeding, ear bleeding from the catheter side, bleeding from the mucous membrane, decreased hematocrit or hemoglobin, gastrointestinal bleeding, genital urinary bleeding, etc. यहाँ पर rational होगा early recognition of these symptoms facilitate the immediate administration of the appropriate antidote. At third intervention, monitor platelet and the heparin induced ear. Rational होगा severe platelet reduction can occur with heparin use. Before intervention, monitor platelet counts, coagulation test Result INR PT activated partial thromboplastin time APTT and hemoglobin and hematocrit. The effect of anticoagulation therapy must be closely monitored to reduce the risk of bleeding. Number fifth intervention, monitor the IV dose and delivery system, tubing or pump. Electronic infusion pump device reduce the risk of overcoagulation or undercoagulation. Number sixth intervention, administer anticoagulant therapy as prescribed bolus continuous IV heparin and or subcutaneous low molecular weight heparin, oral warfarin, comedin, Rishloga. Anticoagulants are given to prevent further thrombus formation. Number 7 intervention, if bleeding occur while on heparin, anticipate the following: stop the infusion, recheck the APTT level, take vital sign of one, reevaluate the dose of heparin on the basis of the APTT results. Laboratory data guide further treatment. The APTT guide 1.5 to 2 times normal. Number 8 intervention होगा administer thrombolytic therapy as prescribed होगा. Lytic agents are indicated for client with a massive pulmonary embolism that result in hemodynamic compromise. After providing these interventions, we write a evaluation. Now here evaluation is reduce risk for bleeding. नेक्स्ट देखते हैं फोर्थ नंबर का केयर प्लान यहाँ पर नर्सिंग असेसमेंट डायग्नोसिस गोल इंटरवेंशन रेशनल फर्स्ट subjective data patient verbalize about pain and objective data distraction behavior facial grimaces guarding behavior nursing diagnosis में acute pain may be related to blockage of the blood flow goal होगा to relieve pain nursing intervention rational देखते first intervention conduct a comprehensive pain assessment here determining the characteristics of the pain, its location, intensity, and the effect of function, and can support further assessment and planning of appropriate intervention. Number second intervention provide accurate information about the condition here and executed explanation of the nature of the pain, present condition, and the treatment regimen can enhance pain control. Number third intervention provide non-pharmacological pain relief here. Non-pharmacological technique for pain relief include relaxation, imaginary positioning, and distraction, and can also work to decrease the work of breathing causing pain. Next, provide supplemental oxygen. Providing supplemental oxygen can reduce can help reduce hypoxia and pain. And here, administer medication as indicated. Pain medications and anticoagulants are the indication for patients with pulmonary embolism to help improve the symptoms of the condition. Do not administer aspirin or NSAIDs that could further thin the blood. After providing these interventions, we write the evaluation for this care plan. Now your evaluation is now pain is relieved. Now देखते हैं care plan number 5 deficient knowledge. Here nursing assessment, subjective data, patient verbalized to know pulmonary embolism, and objective data, patient looking anxious about the new disease condition and treatment. नेक्स्ट देखते हैं डायग्नोसिस यहाँ पर नॉलेज डेफिसिट रिलेटेड टू लैक ऑफ इंफॉर्मेशन अबाउट पल्मोनरी एम्बोलिज्म को होगा टू इम्प्रूव नॉलेज लेवल इंटरवेंशन रेशनल देखते हैं फर्स्ट assess the client's knowledge of pulmonary embolism, its severity, prognosis, risk factor, therapy. Rational होगा pulmonary embolism can be a sudden acute condition for which the client has no prior experience, and assessment provide an important starting point in education. Number second, provide information on the cause of the problem, common risk factors, and effect of pulmonary embolism on body functioning. Here, Risnologa preventing thrombus formation is an ongoing concern, and informed client is more likely to avoid common risk factors. Number third intervention, inform the client of the need for Routine laboratory testing while on oral anticoagulation is rational. Continued regular assessment of anticoagulation is necessary to prevent both recurrence of clot and active bleeding. Before intervention, instruct the client about medication, their action, dosage, and side effect. Sorry, Vishnuga, accurate knowledge reduces further complications. नंबर 5 देखते हैं यहाँ पर discuss with and give the client a list of measures to minimize the recurrence of emboli here. Do not cross the legs at knee, maintain adequate hydration, perform leg exercise as advised, especially during long automobile and airplane trips. Use elastic stocking as prescribed. Rest loga. These measures reduce the potential for thrombus formation. After providing these interventions, we write here the evaluation steps. Now, your evaluation is now improved knowledge level. तो फ्रेंड्स ये था नर्सिंग केयर प्लान और डायग्नोसिस फॉर पल्मोनरी एम्बोलिज्म पेशेंट. फ्रेंड्स आपको वीडियो कैसा लगा इसके लिए अपने लाइक्स कमेंट जरूर भेजिएगा एंड शेयर दिस नर्सिंग केयर प्लान वीडियो विद योर फ्रेंड्स एंड subscribe my YouTube channel on nursing file preparation for the nursing competition examination and press bell icon also. Thank you.